This case is unique in the sense that even though we see a lot of parotid tumors in different patients, females and males and young patients, older patients, this particular patient, she's pregnant and she was diagnosed with a parotid tumor when she had just found out that she was pregnant. So that makes it very different from any other parotid tumor case.
It's kind of a rare situation. Of course, if it's something that can wait until the baby is born, Dr. Osborne would do that. However, with this case, we don't know if it's a cancerous tumor in her gland, and it was progressing fairly quickly. So I didn't want to wait too long or wait till the baby was born to remove the tumor in case it was cancer.
My name is Ryan Osborne. I trained as a head and neck surgeon in South Central Los Angeles, managing the most complex cancer and trauma patients in the country. I've operated across the globe in first and third world countries. My experiences have taught me the value of flexible and innovative thinking, but I realized that our healthcare system doesn't always allow for that. So I started Osborne Head and Neck Institute. I made it my mission to find the best, most creative surgeons around, and I gave them the space to excel. Together, we create a new standard in medicine. These are our stories. San Francisco has come a long way since it was founded centuries ago as a Spanish colony. It's now a bustling and vibrant city, home to iconic landmarks such as the Golden Gate Bridge, Ghirardelli Square, and Fisherman's Wharf. A mecca of food and culture, San Francisco has a Victorian elegance alongside the vibrant technology of Silicon Valley. I spent a lot of time within these city limits as a student at Berkeley. I remember learning to drive stick shift on the hilly roads and finding cool cafes to park myself for a day and study. This is the city you fight to get to. Diverse, expensive, cultured. San Francisco is not a stop along the way, it is the destination. San Francisco is home to many prestigious medical centers. The savvy residents of San Francisco do not settle for second best. This is a town where decisions are researched, vetted, and then checked 3 more times. It's in this setting that we meet our patient, Rhea Rose.
At the end of last year, 2015, I had noticed a lump underneath my earlobe, and I thought it was maybe just my lymph node and that maybe I was sick and that's why my lymph node is just enlarged. I went to see my primary care doctor and she noted it. She had recommended that I see an ENT doctor just to get it evaluated. During my first appointment with the ENT doctor, he told me to just go ahead and get a fine needle biopsy because that's the only way that we're going to find out exactly what it is.
Unfortunately, the pathologist came back with 2 diagnoses that were possibilities, and those were benign, but 2 others, unfortunately, that were malignant.
So to make things a lot more difficult, 1 week after we found out the biopsy from the needle biopsy report, I found out that I was pregnant.
A pregnancy that early in the gestational period, the baby is still developing.
It was a little mixed emotions because it was supposed to be a time when we would be happy that we were expecting and adding another member to our family. But of course, there was a big concern in my heart.
The mother at the same time is worried about having cancer. And so the complex nature of this is that in the patient's mind, they're worried about their baby developing healthily and trying to take care of themselves so they can be there for their child.
And if this happens to be a malignancy, time can be of the essence in getting it out.
You know your best chances of treating any tumor that potentially could be cancerous is to take it out as soon as possible.
Or she could play the other odds that this is benign and wait.
So the first time that I talked to Rhea Rose was probably 6 months ago when she emailed about her diagnosis of a parotid tumor and also stating the fact that she was 10 weeks pregnant.
Anytime you're operating on a patient's parotid gland, you're always concerned about their facial nerve. But at least in those situations, there really isn't a second life that you're kind of thinking about. But now with a pregnant patient, you've got two lives, you've got two people that you're concerned about on the table, and that absolutely complicates things.
We had to make sure that we got the clearance from her OBGYN doctor back home, and then we also connected her with an OBGYN office here at Cedars-Sinai Hospital to follow her and to monitor while she's here and during the surgery. We wanted an OBGYN to be available and ready to come into the surgery if needed, if anything happened.
The baby is going to need to be monitored during the surgery to make sure there's not any fetal stress during the procedure. From a surgical standpoint, we want to be as meticulous as possible. Some of the risks are facial paralysis, which means that the patient's face would not be able to move on one side.
And unfortunately, there are two types of paralysis. There's permanent paralysis, which that never recovers. And that generally comes from somebody accidentally cutting a nerve. And then there's temporary paralysis. And temporary paralysis comes from nerves being manipulated a lot or moved a lot, and what happens is you get secondary swelling and inflammation and edema. The nerves don't conduct electricity very well, and it also looks as if you can't move your face. However, as it is called temporary, as that swelling goes down, as an edema resolves, the nerves will conduct electricity again and the face will look perfectly normal.
The other risks of the surgery are having some kind of facial deformity, depending on how extensive or how far the tumor spreads to different parts of the face.
Now when we start to talk about Rhea Rosa's situation, the risk is a little bit higher. She's pregnant, so we have to consider time now. We don't want her under anesthesia for too long. The longer she's under anesthesia, the longer the baby, in our opinion, is at risk.
The more you know, sometimes it's actually a little bit scarier. I started reading more on the actual incision and how the possible complications of nerve damage.
When I look at Rhea Rose, I realize she's got an Asian ethnic background. I just know from experience that means the caliber and the size of her nerves will be much smaller. I also know her tissue will be more dense and harder to dissect through. So I'm already trying to think, how am I going to approach this person using these instruments and causing the least amount of trauma.
I have kids, you know, and I've been pregnant, and during your pregnancy you're scared regardless because you just don't know what's going on with baby. But putting yourself in a situation like this, I can only imagine it would give me a lot of anxiety.
I think she's going to be great. She has got a very positive attitude going into it. She didn't seem very scared or nervous or anxious in any way about it. And I do believe patients going into something like this with that mindset, the outcome is much, much better. And she's in the best hands possible with Dr. Osborne and Dr. Hamilton, so I'm confident she'll be all right.
We discussed that within a 3-hour window of surgery that they were going to take a slice of it and then send it off, and then the results would come back.
I was really glad to finally see my husband when they finally let him in, and I was just anxious to finally get into the operating room.
It moved along much like I thought it would move along. The nerve was extremely small, very delicate, very elegant, very complex. And the surrounding tissue was very dense, very tough, tenacious tissue, and we had to fight through it. It's like kind of trying to move through the Amazon jungle, cutting down, 12-foot, brush while trying to hold on to the most delicate sort of figurine you can and not drop. It's really using two different parts of your body. You need to use force in one hand, and you need to be very delicate and precise in the other hand. And that's the challenge I thought we would encounter, and that's exactly what we did encounter. When she woke up from anesthesia, usually people are very groggy and they don't know where they are. They're slurring their words. They're very disoriented. She woke up and she immediately said, "What was my pathology? What were the margins? How did it go?" I mean, she's talking as if she'd been awake for 2 weeks. And I found that to be very unusual. But, again, we're all different in life, and she just another example of that.
I was really excited to see my husband and Rylan after surgery, and just to be able to go home and just relax and not be in the hospital.
If I were in the same situation as Rhea Rose and I had this surgery and I went through the type of dissection and trauma that her nerve went through, my face would not move at all. I'd be completely paralyzed, probably for 6 months.
I still feel like there's numbness in my tongue.
The fact that she's moving that much, it's incredible. But it's just a testament to the differences in how we all respond to trauma.
Ready, come on back.
Good morning.
You're back.
The drain is just a little tube that comes out from behind the ear, and it collects fluid that may build up after surgery. That usually gets removed the day after surgery.
Down.
Deep breath out, just keep breathing. Breathe in, breathe out. Drain is out. Gonna put a little antibiotic ointment here. Until the sutures come off, just put a little ointment on twice a day. We should have the pathology back beginning of next week, if not today.
Okay.
I'll call you with it.
Okay.
That's it then, I think.
Thank you.
It's still not determined whether it's benign or malignant. It's still kind of weighing on my mind.
Once we removed the actual tumor and took it out of her body, we cut it in half and we sent half of that to the pathologist to do an intraoperative analysis of the specimen. As Murphy's Law would have it, they still did not have an answer.
So going into the surgery and going through this whole process, of course, our hope was always that the results would just come back as benign.
Usually we get a pathology result after surgery within 1 to 2 days. That's when the case is straightforward and there's no real question as to what the diagnosis is. Every once in a while, there's a lot of question as to what the diagnosis is, and it also involves usually more than one pathologist to make that diagnosis. Unfortunately, this is one of those situations.
When I realized it had already been 10 days from surgery and I hadn't heard anything, then I started getting worried. I found out the results yesterday.
It can't be good news if it's taking this long.
We've been really anxious. We've been waiting since Friday of last week, and we thought we were going to hear from him on Monday, and then we didn't hear all week and kind of just been resting and totally forgot about it. But the other day, since it's been like 10 days, started getting worried. How come we haven't heard? Come here, Riley. Yeah. I'll go on the other side. He needs it right now. You need something. So Dr. Osborne just texted for me to call him back, so we're gonna call him for the results.
When Dr. Osborne told me the report,
what we got back was
The big question in Rhea Rose's case has always been, is this a benign tumor or is this cancer? And even with several pathologists working together, it took them quite some time to finally come up with a diagnosis of a benign parotid tumor.
Had we actually gotten malignant cells, she would have needed to have her incision extended. There would have been probably another 2 or 3 hours of surgery, as we would have had to have assessed the lymph nodes in the neck and tried to see if there's been any spread of that cancer anywhere else.
The actual definition would ultimately define it as pleomorphic. You see at least 3 different types of cells in it.
Thanks for the good news.
Okay.
Thank you. Okay.
Bye.
Here you go. That's good. Nothing to worry. The more we didn't know, your mind starts to take a path, like, why is it taking so long? If it was good news, they would have said something.
I thought they were taking so long because they were like, if it was going to be bad, that they wanted to confirm and make sure that it was bad before they told us. So that's where my mind was racing. I'm just glad it's all over with. I'm glad it's benign. And I'm really glad I chose Dr. Osborne. No doubt.
the feelings that were going through my mind was relief that I didn't have to worry about not being here for my family. I think that's the number one thing that was devastating for me. I want to be here for a very long time. I want to be here for my kids. I want to be here for my husband. And the fact that the results coming up as benign, then I just felt I was so happy. I was so glad that that's what it was, and I don't have to think about that, and that's not what could be my reality in the next 5 to 10 years. So now that we finally got the results and we're healing from the surgery, I need to focus on this baby. I'm 24 weeks and he probably hasn't gotten all the attention that he's had because I had to focus on myself and making sure that I was okay and that I would be okay even during the rest of the pregnancy and after. And so now that this is all said and done and we know that everything is fine and I don't have to do any radiation, I could just start decorating the nursery, buying things for the baby, doing happy things, and just being excited for the new addition to our family.
I'm not going to tell someone that there is no risk. There is risk. And whenever you're manipulating someone's nerve that much, there's a high chance they're going to have some temporary paralysis. And you've got to get them to understand success in this surgery may not be what they think it is. But you have to bring them back to reality. You have made it through a surgery, you and your baby safely. The tumor is completely removed. Your facial nerve was not cut. Your pathology was benign. And you may have a little bit of temporary weakness just from edema, but that will resolve in a few months. So at the end of the day, this is a 100% success story. I mean, I'm extremely happy with the results. But it's, again, keeping people in perspective, being very straightforward and honest, and understanding we're just here to help. I'm just a man, I'm not God, but we're trying to do God's work here.